Hello everyone and welcome to our latest Care Insta Live. The topic of this Instagram Live has changed slightly. We were going to be talking about the preparation that Care is undergoing at the moment to reopen, which we are still doing. We were limited to a few services, namely the semen analysis testing, which we will talk about a little bit later. But there's been some quite large developments over the last few days, as many of you will heard from Matt Hancock announcing that fertility services are due to resume treatment from May the 11th, which is next Monday. So we will add a little bit more onto that. I say we because I'm going to be joined very shortly by Alison Campbell, who is the Group Director of Embryology with us here at Care. She was also my mentor when I was a young budding embryologist, and she's someone I've known throughout my whole career and I'm exceptionally proud to work with. So Alison will join us very, very shortly. Hi Alison, if you're there at the moment, send me an invite over and I will bring you in on the live chat. So, what have we been doing following our last Insta Live? Well, our inquiry teams have been working non-stop. We had so many questions following the last live that we've been working really hard to answer and get back to you. The dedicated patient inquiry team has been fielding lots of calls, booking lots of appointments for us virtually, of course. Social distancing is something we are becoming pros at the moment. If you do need to get in contact with us following this Insta Live, please contact us through the group inquiry management hotline. They can be reached on 0800 564 2270. Alternatively, contact us through the website at carefertility.com. Through the inquiry team, you'll be able to book a virtual consultation, depending on where we are next week. And the following weeks, we'll then be able to arrange follow-up sessions with doctors to arrange for blood tests to be taken. Semen analysis can be booked immediately, and we can start planning treatments when we're given the green light. So what else are we up to at the moment? We are doing all our treatment planning virtually through the online consent system. We are providing blood tests for patients remotely when we can, providing protocols and injection teachers all through the videos. So without further ado, let me go and see if I can find Alison on here. Okie doke. Right, let's have a little look. Right, we are going live with Alison Campbell very soon. So the invite is being sent over to you, Alison. When you accept, there she is, everyone. So this is Alison Campbell. This is my mentor when I was a young embryologist. Alison is also working with the professional bodies at the moment to outline new guidelines for fertility clinics to reopen. So Alison, do you want to introduce yourself?
Yeah, well, I heard you saying about the good old days when we first started working together. Thanks for that nice introduction. Yeah, so I've been ever so busy. I'm sure all of us have, really, just trying to prepare, communicate with each other, further afield, looking internationally to learn from other people's lessons and how they're resuming practice. So as you just said, Rob, I've been involved with developing some professional body guidelines, which should help clinics when they start to resume practice with IVF treatments. So what we're doing now is awaiting a self-assessment questionnaire and working on our strategy. And this is for the HFEA, who, as we know, have said that we can apply to resume practice from next week. So that means that we can at least apply, we can show them what the work that we've done, demonstrate that we're ready for safe practice, and then they'll assess our application and let us know whether we can go. They've suggested it'll take them up to 5 days to process our application. So best case scenario, we would apply early next week, and it could be later next week or the following week when we get a green light. We're confident that we'll be ready. So it's all good news, really.
Absolutely. We've all been working very hard on this. Lots of patients have been contacting us saying, can we start treatment immediately? Can we start taking our drugs so we can have a frozen embryo transfer next week? What the HFEA have categorically said is that centres may not commence any treatment whatsoever until we have had written approval from our inspectors that we have the green light to resume treatment. So we understand everyone is very anxious at the moment and does want to start their treatment as quickly as possible. However, we must comply with the government's recommendations. We will be applying since we received the assessment tool. Sometime next week is what they've told us. It won't be the 11th of May on the dot, but since we receive their guidance, we will be responding. Alison will be responding on behalf of the whole of care, and we will be implementing everything we need to ensure we can resume treatment straight away. So Ali, can you just briefly outline what care is doing at the moment in terms of preparing ourselves to reopen?
Yeah, well, we've been working with patients directly to get them treatment ready. So we have still been offering Skype consultations, and patients can still book in for those now. We have been offering semen analyses. So we're doing a completely socially distanced semen analysis whereby we post out the pots, and the guys can drop the sample in by arrangement for us to do the analysis. So all of these things can help patients get ready for the treatment. We can also do online protocols and online consenting. So I think it's really important that patients contact the local care clinic, because we have a large network. We've got 12 clinics, very well resourced across the UK. So current patients and future potential patients should get in touch with their local clinics and see what they can do to start preparing.
Perfect. That is quite right. We are all going to be applying individually as a care clinic. So Christina here, Gusol said, is the application for all clinics? So each clinic within care is a part of the care group. We all have individual responsibilities, however, with the government. So we will, Alison and the team will put together the guidance for all of us down here in the local clinics. The likes of myself will be responsible for implementing everything Alison suggests safely and ensuring that any patient who comes in here and all the staff who return from being furloughed are safe in being able to provide the treatments. Then we will apply to our inspector and ask for the authorization to resume the treatments. All the clinics across care will have to do this individually. We don't do it as a group because we all have different individual restrictions and different ways of working based on the geography of the clinics and the way they work. So it is slightly different. We can only talk for care. We can't talk for any other clinics out there who will have to apply the self-assessment tool individually. So Ali, one of our patients here has asked which care clinics are going to apply to open?
Well, all of them. Yeah, all of them. And we have the same governance structure. So it's not going to be 12 times the effort for us to make an application for all of our 12 clinics. We'll do as much as we can centrally. We've got best practice, we've got standards that run across all of the clinics. So we're going to work together to make it as efficient as we can.
Fab. Moving on a little bit, Colette 86 said, is it safe to resume treatment? How safe will it be to socially distance, specifically for the frozen embryo transfer procedure?
Right, well, we've had to consider all of these things, and we're going to be talking to all the staff and all patients, sort of triaging them, doing a questionnaire basically to make sure they're in good health and the risks of the virus being present or being transmitted are minimised. So we'll have some personal protective equipment, the level that's recommended by Public Health England, and we'll keep appointments distanced, we'll reorganise the waiting areas. So we're thinking of all these things to try and minimise the risk for patients primarily, and of course also for staff.
Yeah, I totally agree. I mean, Colette specifically spoke about their socially distancing for the frozen embryo transfer procedure. For anyone who's had one, it's a very simple process where the laboratory thaw out an embryo, and that's replaced back into the body. It's different from when we collect eggs from a patient in the fresh IVF cycle, which is a bit more invasive. It requires sedation. Now, this is more complex for us to work around social distancing. Our anticipation is such that frozen embryo transfers and processes called IUIs would be most likely to start off. Would you agree, Alison? And depending on where we get with social distancing and what our inspectors recommend back to us once we've applied to reopen, fresh IVF cycles will take place soon after, because they take a little bit longer to plan, but not far behind. Clearly, there's more difficulty in social distancing with those, but we are thinking ahead. We are planning, and we are looking at there not being any delaying us being able to provide this treatments as quickly as possible. So we've had another question. Which patient's treatment will resume first? Will NHS treatments resume? Ali, do you know much about that?
Well, not really. We know that we do treat NHS and privately funded patients in exactly the same way. So if we have NHS patients in the system coming through to us, then that's fine. They will progress as you'd expect. We can't really speak for NHS facilities. And of course, in some of those big NHS hospitals, many of their staff, even their fertility staff, have been redeployed to help with the wider effort. So it may take them a little bit longer to get back to normal, but we don't really know. All we know is really what's happening under our own roof.
Yeah, absolutely. I'm just reading here. Will patients who are, this is from Birdie Esther. She's asked, will patients who are about to start treatment be prioritised? Similar to NHS and private patients, that patients who are in the process of treatment, we will absolutely get you started as quickly as possible. We have lots of patients who are delaying their treatment at the moment. We are going to start safely. We will plan everyone as effectively as possible. Everyone's got different start dates. But those patients who were in the process of having treatment, we do have the greatest sympathy for, and we will be processing your treatment as quickly as we possibly can. So let's move on to another question. Will you be able to resume investigations? Daniel Borden has asked, when can investigation procedures continue? And will AMH testing and sperm analysis still be done remotely before we can be seen in the clinic?
So we're already doing the diagnostic semen analysis as I described. We're also being able to test for AMH by sending a blood sample, so a pinprick test that patients can do at home and send off the results. And I would say that this will continue. We will try and minimise visits to the clinic where we can, minimise visits for monitoring and the diagnostic things that's possible, remote consent, guide consultations, anything that we can do to keep the patient safe and at home and minimise travelling and visiting the clinic, then yeah, we're going to do all of those things.
So Ali, talk us through it. The diagnostic semen analysis testing, how are we going to keep men who need to produce their samples socially distanced from us scientists who are going to be analysing them?
So, well, as I said, they can, we post out the pot and then we'll receive it through the mail. They'll produce the sample at home. You know, this is, if they're happy to do it this way, they need to bring it to us within 1 hour. We need to be expecting it so that we've got the staff ready. So there'll be there's an instruction leaflet. They can phone us. We can agree a time. They bring the sample. They can put it in a special place. So depending on which care clinic they're going to, then that will be specified where they need to leave it. The scientist will take it straight away into the lab, do the analysis, and the results will be ready within half an hour or so. Go to the consultant. We'll have hopefully done the consultation or may do it soon after. So we're going to get all this stuff together, and it's already in place, the diagnostic semen analysis, so that patients can be treatment ready. We've also prepared for treatment sample production, so we're a step ahead with social distancing, with cleaning of the areas, special patient information, personal protective equipment for staff and patients if applicable. So all of this is, we're ready, it's all in place. So no reason really that we can't get these patients ready for treatment.
How about this question, Ali? It's a slight spin on the diagnostic theme. Mr. and Mrs. IVF have asked, when can my husband book a sperm comet test? Will the samples be sent, I think they still go to Ireland, or will they be stored in the clinics for the time being?
I think we could still do it. It's we produce the sample just as I've described. We can flash freeze it, which is required for the comet test. And then we'd ship it over. I mean, medical couriers are still working, so there's no reason why we can't proceed with that now.
Brilliant. And Rachel asks, when will I be able to Zoom with the Alice or Emma biopsy test? That will need to be once we have been provided with the approval to resume treatment. But Rachel, stay in contact with your local clinic, and as soon as we have approval to resume, we will certainly be able to provide you with those tests that you need to continue on. We'll consult Ali. It's a really good one actually, because it's. I think this is affecting most industries across the country now in terms of changing the way we work. Will consultations still continue to be by Skype? Will I be able to choose whether to have my consultation face to face, or if I do it over the internet?
I believe we will be able to offer choice. If that's preferred to come into the clinic, then as long as we can comply with the guidelines that we're setting, keep the distance, because I can understand it, for some people that would be preferable. I mean, I can't imagine how much time I've spent on these social media platforms or these conference meetings platforms, and it is becoming normal, and I'd say now it's as effective almost as face to face.
Yeah, couldn't agree more.
No need to.
I think that's brilliant. I mean, Zoom is my favourite four-letter word at the moment to keep me busy at weekends and in touch with friends. So I'm just looking through a few questions here, everyone, whilst Ali and I carry on chatting. Amy Bauer said, as many patients did before we were forced into a shutdown, she had to freeze all of her embryos because of the closures. Do I need to contact my clinic to be put on the list? Now, Amy, if you haven't heard from your clinic, then definitely get in touch with them. Let them know you want to resume straight away, and they will start the process of adding you onto their treatment list. Now, that goes for everyone. Anyone who is trying to contact the clinic to arrange a treatment, contact the clinic now. There are people working, nurses, administrators, doctors, scientists, in all of the clinics. Someone will get back to you. So make sure you get your name on a list, and you will resume your treatment as soon as we possibly can. So moving on, a little bit about donation now. When will the donation team start matching again? That goes for egg donation, sperm donation. Ali, let's ask a question on sperm donation. One of our patients has asked, would it be quicker to look at another sperm bank? So she must mean importing, or he mean importing from a sperm bank, if the care teams are not currently matching. Can you say a little bit about the care sperm bank for patients who need to be matched with a sperm donor right now?
Yeah, well, we do. We have a donation team, and we have obviously we're on a skeleton staff at the minute, so things might have been moving a little bit slower than normal in terms of matching. We're going to start changing that over the next week or so, obviously in anticipation of resuming work. So yeah, I would get in touch if you are a patient who needs donor sperm or donor eggs. Get in touch with contact our general inquiry management team. It's a big team, and they can divert the call accordingly, and we'll get matching. We have a donor sperm bank at care. If we don't have a suitable match or the wait is too long, then we can recommend some external banks. We've also got a really rather large frozen egg bank, which we're poised to start matching to now. So also egg recipients, please do also get in touch. We've got plenty of
Yeah, we had a question from Charlotte at 15. How soon will recruitment of new egg donors recommence, and how are you going to do it? So Charlotte, in all of our clinics, we have had a member of our nursing team and the donation team who have been working to screen donors who want to come through. Here in London, we have a large number of donors ready to start treatment. We will be starting them as soon as we possibly can. Diarising them and putting them into a planner with all of our patients who also want to start their own treatment, and starting the treatments in a very coordinated and safe way. So we are going to be we haven't stopped recruiting donors throughout the whole of this. Almost in the entire amount of our donation is done virtually with donors. The counselling, the consultations, blood tests not so easy, but we've completed the large majority of the screening already. So if you wish to donate eggs, get in touch with the local clinic. If you are looking at receiving eggs, you need to use donor eggs. Again, get in touch with the clinic. We have the Fertility egg bank, so we have lots of frozen eggs, and each clinic has a number of donors who want to share their eggs as part of their own treatment, or they're donating altruistically, at which point sometimes we're able to match the donors with yourselves in a fresh cycle, or we just freeze all the eggs and then you can come through whenever it's convenient for yourselves to do so. Georgia, I said I'm hoping to do a second egg donation. Will you be resuming donations as well? Yes, we absolutely are. Right, yeah. I've got a few, I'm getting loads of questions just popping up here, Ali. My Metro card said, missed that lag. Did you say first number transfers require sedation? Only if the doctor's told you that you need sedation. Craig Dotson, just responding to you about the Alison era Bartu results. We haven't sent any samples off at the moment. We use a private courier, so we wouldn't expect there would be a significant delay in receiving those, but we won't know until we have resumed all the treatments and have been doing those cases ourselves again. So for new patients, Ali, we've got some questions here. Shana Stell Thomas has said, will you be accepting new NHS patients once you resume treatments?
Yeah, yes. I think there probably is some confusion generally about which treatments we're anticipating being able to do. And I think that's important that we do not expect that we'll be restricted in terms of what types of treatments we can do, providing we can demonstrate that what we can offer is safe. And that's what we've been doing for the last few weeks, is preparing the ground for that. So we do not anticipate that there'll be any treatments, fresh, frozen, surgical sperm, donation. We don't think there'll be any of them that are excluded. And whether it's NHS or privately funded, same thing. We think if we can demonstrate safe practice, which we believe we can, then we'll be back to normal. I mean, some things will be different, of course. We're going to have, the clinics may look a little bit different. Staff may be dressed a little bit differently, but the treatments will proceed, and we'll be working on our scheduling. The working day may be longer. We're just going to put all these measures in place primarily for safety.
Yeah, absolutely agree. Running the clinic here in London, we're doing lots and lots to put safety measures in place for patients and staff alike. Question we have here is, will all your current patients start their treatment before new patients are accepted? No is the honest answer to that one. We're accepting new patients right now. New patients need to have quite a lot of investigation done, and there's a natural delay before you can start treatment. So the patients who are delayed during the coronavirus will start off straight away because there's very little planning required with them, because we know what protocols we're using, what drug protocols we have, and so on. So they will start off naturally. The new patients, we're not going to delay. We will just continue our process as we usually would, and you will receive the treatment you need in the fastest possible time, which is what we do for everyone all year round, regardless of a pandemic. So we're looking at no difference to the way we resume treatments. Beth Home 25 said, will we be contacted directly about our treatment and when it will start, or should we contact the clinic? Will care contact us by phone or email? Ali, I can answer that one because we've been doing this non-stop during this shutdown. Beth, we have been contacting everyone who was in treatment or planning treatment prior to the delay, prior to the suspension of our activity. If you haven't heard from your clinic, do contact them. If you've heard from them, you will know they're contacting you by email. Fairly regularly. You would have got an email on Friday when the government made the announcement that they are going to be resuming. We can apply to reopen our centres from sometime next week. If you haven't heard anything, get in contact with your local clinic ASAP. Right, let's have a little look here. Medications. Joanne Louise 84 has asked, will we receive an email or a phone call to tell us when to start using our meds? Ali, again, I can answer this one. Patients have all been sent protocols who are ready to start treatments. Those who are cancelled, we had their treatment protocols already planned for. We will let you know when you need to start your medications. Nothing is going to happen until middle of next week, I expect, when the government, as Ali says, is going to supply us with the assessment tool we need to respond to apply to reopen. We will hear probably back 5 days is what they said, once we, the HFEA have said, once we have applied, which will take us probably into the middle of the week after. So for another couple of weeks, I'm afraid, everyone, there's nothing more we can do. We are planning here in the clinic, though. We are making our reception areas as safe as possible, resourcing as much PPE as possible without taking it away from the NHS. And we're being very sensible in our approach to make it safe and ensure we are not negatively going to be affecting the NHS when we start treatment again. Okay, 9W by... have I newbie 90 maybe? I hope I've pronounced that correctly. Has there been any clarification about COVID-19 and how in particular it may have affected NHS funding for fertility treatments? Ali, are you able to answer anything on that?
Yeah, I don't have any information on that, but I can understand for patients who have funding or a certain number of cycles and timescales are ticking, that they might be concerned they could lose their funding. So they're going to have to talk to the funding body and try and understand what's going on. But I would expect there'll be some guidance coming out about that.
Yeah, I know a little bit of that about that, talking to my colleagues in the different clinics around the country. Now, it varies. It sounds like it varies quite significantly depending on which care commissioning group the area you're based in. The best thing to do, as I think will be quite a common theme, a little golden thread running through this little Insta Live, is contact your local clinic if you have these questions. If you are unsure, speak to them. Some CCGs have been spending a lot of money resourcing the front line for this battle against the COVID-19. Others haven't been affected so much. So there might be different resourcing issues in different areas, but your local clinic director will know the answer. If they don't, they can contact the CCG who's providing your funding to find out for you. But we are here to answer all your questions, so please just get in contact with us. Sarah House 81 has asked, should we arrange tests in anticipation of our first consultation? Ali, would you like to quickly ask some...
What we have on our website, which I think is really quite clever, is a checklist. So it goes through, what do you need? What could you be doing to get treatment ready? So if you work through the checklist, and it's going to be a consultation, protocol, consents, really helpful tool to help patients just understand what else they could be doing now to start preparing for their treatment over the next few weeks and months. So I would suggest have a look at that. And there are some treatments which we may be able to start some preparatory medication. So perhaps for frozen embryo transfer, there's one of the drugs that we take early on to prepare for that. You could start that sooner rather than later. So certainly talk to your clinic and we'll get you all started as quickly as we can.
Yeah, and we can answer Adam B. Wood's question here. He said, hi, we received our drugs today. Unfortunately, we all went into lockdown. Can we pick up where we left off when we go ahead? Adam, absolutely. You are in the driving seat there having your drugs. You just need to contact your clinic, let them know you're ready to go, and because you've got everything, they will provide you with a protocol and get you going as soon as we possibly can. Vicky Johnson, you didn't receive an email either from your clinic. You're going to log into your portal Vicky, the emails were going directly out to lots of the patients that we have on our waiting lists who had been delayed because of the COVID-19 pandemic. Contact your local clinic, let them know you're here and you want to get going as soon as possible, and they will pop you on their list, and then you'll get regular communications from us.
Can I just say something quickly? I've seen, I know I'm not a common user of Instagram, but I've seen these questions coming up, and a couple of points about Chester. So Chester's one of our newest clinics, newest in the family, and they are an amazing team. They're a little bit different to the rest of us because we're not completely integrated yet. So they're not on our systems, all of our systems. So in terms of general inquiry management, and there were a couple of negative comments. I just wanted to apologise for that, but they're in the middle of an NHS hospital in the northwest, which has been quite severely affected. So some of their staff there have been redeployed to help in the NHS hospital. So that might be the reason. I expect that if you haven't had communication as quickly as you'd like from them, but I'll have a chat and we'll try and get back to you.
Yeah, absolutely. We'll feedback all the questions we're receiving here to the individual clinics, so they're aware that when there's any issues, they can help you all out. Just to answer one question I've quickly got here before we go on to answer lots of general fertility questions. IVF journey to baby K. Have CARES anaesthetic staff been redeployed? A few of our centres, the nurses do all their own sedation. In other centres, we employ anaesthetists to come in to do the procedures for us. Some of these anaesthetists work in the NHS. Some of them are just fully private. I can speak from London here. We are in contact with our anaesthetics group. Some are solely based now in intensive care in the NHS. We are not going to ask them to come back and help us because they have a far greater priority on their hands at the moment of doing the wonderful job that we are. However, we have a large resource of anaesthetists, and we're going to have all the anaesthetists who don't work in intensive care who are going to come and carry on providing the treatment for our patients, because it is well acknowledged now how important all of you are, and the treatment for all of you is, as time is moving on, we need to get treating you as quickly as possible to give you the very highest chance of success. So then, Ali, I'm going to go on to some general fertility questions. I haven't read them yet, but I'll read them out as I go. But the first one I'll give to you. So on my husband's semen analysis, it says a density of 11 and told 15 is normal. So it must be referring to the number of million sperm per mil. So is this extremely low? His morphology is 2%. His motility is normal. Are you listening to all this?
Yeah, I'm taking it.
We are both 30 and have a failed round of ICSI. So he's got a count of 11, he's got a morphology of 2 and a normal motility, and they've had a failed ICSI cycle. What's your recommendation?
Well, I think the question was, is that really low? No, it's not really low. It's maybe on the lower limit, but probably as important, if not more important, for me anyway, as an embryologist, is the total motile count. So that 11 was number of motile sperm per mil, I think. So if volume is 1 mil, that's 11 million. But if it's 3 mils, then that's 33 million actual sperm swimming in that sample. So it's not as simple as it might seem. ICSI failed in the past. The morphology, which is the shape of the sperm heads, sounded 2% is quite low. And semen analysis, it's a funny thing, and it can change. You know, sometimes we have 2 samples from the same man in a day, and they are quite different. And often the second one is better than the first one. And certainly when samples are analysed every few months, they can change. The spermatogenic cycle takes around 3 months, and so a lot can change depending on lifestyle or many, many factors. So I would say, you know, it's very disappointing that the ICSI cycle failed. I don't know which stage, but I'm assuming after embryo transfer there wasn't an implantation, but I mean it could have been at a different stage. So talk to your clinic and keep trying if you can. Yeah,
I totally agree with all of that. Really good question here. How does IVF work for gay couples? Well, I can tell you it does work because we've had lots and lots of successful pregnancies and families now created for gay couples. So we have same-sex female couples and we have same-sex male couples. For same-sex female couples, the usual route is through shared motherhood, where one of the partners will donate their eggs to the other one, who will carry the baby, and vice versa. For male gay couples, it's a case of finding an egg donor and deciding which one of you is going to donate the sperm. Maybe it can be both of you, and we can create two separate sets of embryos, and then it's popping an embryo back inside a surrogate to create a pregnancy. So all is very successful. For gay couples, majority of the time there's no underlying infertility. So it's a question of how old are you. We all know the older you get, the more difficulty you have in trying to conceive. So contact a clinic. All of our clinics are capable of handling female same-sex couples. You do need to choose a clinic that is experienced in surrogacy if you are a male same-sex couple. Okay, Ali, let me find another question for you here. Perfect. We've had one IUI and IVF treatment through the NHS, and we're supposed to start a paid treatment this month. During our last round of IVF, they told me everything was looking really good and reduced my meds, but when we came for egg collection, I only had 2 mature eggs. Unfortunately, it didn't fertilise. Is there a scientific reason why sometimes you have lots of follicles, but you only get a reduced number of eggs?
It's quite hard to predict how many eggs we're going to get, and what would probably happen in this particular circumstance would be that at a review consultation, the doctor will have a look at the stimulation protocol and maybe make some modifications. So 2 mature eggs were collected. We could try and collect more than that. I mean, 2 can be enough, and if they're good quality eggs, we only need 1 embryo. It can often be enough, but it is much better if we can get a higher number. It increases the chances of getting a good number of embryos to choose between, and we're really experienced at embryo selection. So I would say that the consultant may be able to adapt the protocol, the clinical medication protocol, to try and get more eggs. But I mean, it's not easy to answer that sort of question with limited information. It's every case is very different from each other.
Yeah. I think a bit of maybe something in that question was the fact that they've reduced the drugs at in my question would be at what stage, what was the reduction what was the change in the dosage of those drugs. Best thing you can do is take all the information from your previous cycle in the NHS to one of our doctors who can review it and provide their best opinion on that. So we received a question just here. It just popped up. Where's it from? It's from Rachel Dickinson. What time frame would you recommend between 2 pregnancies? Rachel, we're so sorry to hear you unfortunately lost your daughter at the start of the year after a successful IUI treatment with the care team in Bath. So what would we recommend there, Ali? Do you know, or is that a question for a doctor?
I'd say it's a medical question, and it might depend on the stage of the loss and the recovery. So I'd say, certainly take some one-to-one advice on that one.
Yeah, Rachel, we will forward that question over to the Care Bath team and ensure someone gets back to you on that question. So let me just see what other questions we have coming in here. We've had so many, everyone. I'm so sorry. We're not going to get to answer all of these.
There was a question about PGT-A, and this is for people who don't know, in very simple terms. It's when we take a biopsy, a few cells from the blastocyst, an advanced stage of embryo development, and send them to the genetics lab to effectively count the number of chromosomes. And we know as female age particularly increases, the number of errors in the number of chromosomes increases. And with that, decreases the chance of successful outcome, increases the chance of miscarriage. So it's a very important technique. And I've been giving it quite a lot of thought at this time, really, because it's a possibility. We could use this to sort of make up for lost time. So if a patient had 5 frozen embryos, for example, in the freezer in our care clinics, and they're planning to come back and have sequential frozen embryo transfers just to try and get the baby that they've dreamed of, then we could thaw them out, perform PGT-A, so that effectively screen them to see which ones have the right copy number of chromosomes and the best chance of implanting and transfer those ones preferentially. So it's an amazing technique. It's not for everybody. It's particularly indicated for advanced female age, but one of the tools that we've got that can help in some circumstances.
Yeah, and all of our laboratories are open here because they don't require any patients to come in to do any additional testing such as that which Ali has just described. We can do that immediately for you, and it's a very powerful tool that we can use to select the best embryos to pop back, and something we can certainly help you with right now. Just contact your local clinic to find out a bit more information about that. We have received so many questions here. We will use these to update our frequently asked questions page on the Care Fertility website. So please go on there and have a look if you need to get any more information, and we'll be contacting everyone individually. Wizzy Pig has asked, are you still doing follicle scans at the moment? And what is the process for semen that is due to be frozen? So follicle scans aren't being done yet at the clinics, Wizzy Pig, because we don't have any patients in treatment. Ali, semen freezing, what about that?
Yeah, we've got it counts as treatment, I think. So we'll have to wait, but we can get an appointment in and do it. If it's for oncology, if it's for pre-cancer treatment, then of course we can do that immediately. But if it's for other reasons, I think we'll probably have to wait a few weeks, but not very long.
Perfect. Yeah, that's a really good point. That semen freezing is a licensed procedure that we can only do once we've been given the approval to resume treatment. Let's see if I can find one more question here. There's a question on the PGT-A, Ali. PGT-A, is there an extra cost to that? How much is it?
Yeah, there is an extra cost. I don't know off the top of my head, do you? Is it?
It's £295 per embryo to screen in London, and it is £1,450 to thaw out the embryos, biopsy and refreeze them, but we will reduce the cost of that by 10%. So we'll take £140-something off to try and make this treatment a bit more accessible. I appreciate it's a minimum amount on a quite an expensive procedure, but it's an extremely technical process we put the embryos through. It comes at a great cost to be able to do this hugely advanced level of genetics. Right then, we're going to have to call it a day, I'm afraid, there, team. We have been going 40 minutes. Listen, contact your local clinics if you have any more questions. If we haven't asked your questions, someone in the clinic will answer them. I'm here in London, so anyone who's a London patient, feel free to get hold of myself. Ali's based around the whole of England, so send every other question to her that you have. We'll be posting a lot more information over the coming days as we start to make progress. As Ali works with the professional bodies developing the new guidelines, which all fertility clinics in the UK will have to work towards, we will get the inside info from her as to what is happening and what we need to be aiming at, just so we can open up as quickly and safely as possible when we can. Go on to Care Fertility website. That is where you will find loads of information about your pre-treatment checklist, what you can do to prepare yourself in the best manner possible to undergo any IVF. Ali, is there anything you want to say before we sign off for the day?
Yes, I think just to say, if you look on the website for the general inquiry number, if you're not getting through to the local clinic, because we are on a reduced staff, we have people manning the phones on the general inquiries, and they'll be able to help you and divert calls if you're struggling to get through.
Yeah, Muljo, Nikki I822. I'm good friends with the clinic director up in Manchester. I will call her right now and just tell her that you are struggling to get through to anyone. Nikki, if you contact them in half an hour's time, I would have already spoken to the team over there. So they will get back to you as quickly as possible. Anyway, everyone, thank you so much for listening. Thank you so much for your positive feedback from the last Insta Live as well. Hope you've enjoyed this. Thank you, Ali, for being amazing, as you always are. You take care. Everyone stay safe, socially distance. Enjoy the bank holiday weekend, and we will be back in touch as soon as we have some more information to share with you. Have a lovely day, everyone, and send your questions through. We will be answering them as we go on. Okay. Anyway, you all take care. Bye, Alison.
Bye. Bye.
Bye.